Now, what about this idea, again, that's really circulating out there saying, you know what, this thing is just so infectious. Why don't we all just get infected, get it over with, and then we're going to end this pandemic that way?
Unfortunately, by all of us getting it and all of us getting over it, we're going to have an exceedingly high mortality at the same time. As you've noticed, as well as the president noted, we are seeing more deaths because it's so infectious. Do I really want people to get a virus that in a certain population will be lethal? Absolutely not. So I'm not really excited about saying, go ahead, have a chickenpox party. Go ahead, have a COVID party. Let everyone infected. That's just not a good idea.
All right, let's talk about those CDC's move to obviously update that guidance, changing the quarantine period for people, who are exposed, who've been boosted. A lot of people just confused by this. So what do you think is the best way to clear this up for people at home to understand this new guidance and how long they need to either stay home or wear a mask?
So the first is if you've been vaccinated and you get infected, you should definitely stay home for the first 5 days. We count day one as the day you had your test. We've been talking about is day one the time of symptoms or not symptoms, but really for healthcare workers and other first responders, it's the day you had your test. Staying home for 5 days is really important. Those are the days you're shedding the most virus. After day five, i.e. on day six, go to work. Wear a mask the entire time. You may still have some low virus that's circulating in your nose that potentially could be infectious. On the other hand, the numbers are quite low, and it's less likely, especially if you're wearing a mask and the people you see are also wearing a mask. So if you're feeling well, meaning you have no fever, not taking your mask off to sneeze every 3 minutes or coughing and having to take your mask off, you can go back to work. For those people, though, who are sneezing uncontrollably or coughing or throwing up and unable to wear a mask consistently, they should not be going back to work, because they are still an issue for spreading virus to other people. And frankly, they're still pretty sick and they're really not going to be able to work to the best extent.